Good afternoon and welcome to the Committee on Commerce and Labor. Secretary, will you please take roll?
Assembly members Anderson, present. Carter, present. Cole, here. Hardy, here. Howdigi, Kasama, here. Miller, here. Monroe Moreno, O'Neill, Roth, here. Torres Fawcett, Yeager, Urick, Chair Marzola.
I am here. Please mark members present once they arrive. Welcome everyone that is here in Carson City. There is no one in Las Vegas and those tuning in over the internet. Today we will hear two bills, Senate Bill 260 and Senate Bill 316. We will conduct a work session. Before we get started, I would like to make a few housekeeping announcements. When testifying, please remember to turn on your microphone to speak and off to listen. Also remember to state and spell your name for the record. Committee information is available on the legislature's website. You may also watch our meetings through the legislature's YouTube channel. We ask that public comment be kept to 2 minutes so that everyone may be accommodated. As always, I expect courtesy and respect in all our interactions, even if we may not agree. Finally, please put all your electronic devices, especially your cell phones, either off or on silent mode. And with that, we will start our work session. Since we are conducting a work session today, I do want to put on the record that the Speaker has waived the 24-hour rule, and so we will work session Senate Bill 173 today. While conducting a work session, it is to take action on measures the committee has heard in previous meetings. It is not customary for the committee to take testimony or otherwise rehear a bill during a work session. I may invite witnesses to come forward for clarification or questions during the consideration of a measure. We will start with our only bill on work session today, which is Senate Bill 173.
Senate Bill 173 establishes provisions relating to the environment, sponsored by Senator Neal, heard yesterday, and there are two proposed amendments.
Thank you. Committee members, are there any questions? I don't see any. I'll entertain a motion to.
Second.
So moved to amend.
Thank you. I didn't even finish.
I read your mind.
I have a first from Assemblymember Miller, a second from Assemblymember Carter. Is there any discussion or questions on the motion? Assemblymember Kasama.
Thank you, Chair. I just wanted to put on the record that I will be voting no, but I wish I could vote yes. There's so many things about this bill that I like, as far as the disposable utensils, the trees, the heat mitigation, so many other things. But the section I had concerns with was the section 24 regarding the manufacturers, and I just feel like we're not giving them. I think it's good to avoid those products, but I just don't think we're giving them enough time or options for other products. And so that's why, unfortunately, I like really everything else about the bill except that. So thank you.
Thank you. Any further discussion? I don't see any. All those in favor say aye. Aye. All those opposed say nay. Nay. Please raise your hands. I have a nay from Assemblymember Kasama, Urick, Cole, and Hardy. Motion passes. I'll assign that floor statement to Assemblymember Roth. I will now close our work session and move on to our first bill. One minute recess. Committee will come back to order. I will now open the hearing on Senate Bill 316. This measure revises provisions relating to insurance. Welcome, Senator Nguyen. You may begin when you're ready.
Chair Marzola and members of the committee, I'm Senator Rochelle Nguyen, representing Senate District 3, and today joining me at the table to hopefully answer all the questions that I can, and probably some of the better, she'll be better at answering the questions even than I can, is Kaylin Cardavani from New Day, Nevada. So thank you for hearing our presentation on Senate Bill 316. Too many Nevadans cannot afford their life-changing and life-saving prescription drugs and often have to make a difficult decision based on what they can and cannot afford. Senate Bill 316 is addressing one piece of the prescription drug costs by tackling the issue of pharmacy benefit managers, or PBMs. These prescription drug middlemen have manipulated the market, driving up the costs of drugs and putting smaller pharmacies out of business. PBMs are often not talked about as they operate as an invisible middleman responsible for negotiating drug prices on the behalf of health insurers. These price negotiations were intended to benefit patients initially and employers, but that is no longer happening. Instead, we've seen our drug costs continue to rise. Simply put, large corporate PBMs have a directive to make profits and will pocket any prescription drug rebates. Patients are not their priority currently, and in this bill, it ensures that patients are put first over shareholders. How do PBMs extract money from patients? In this country, there are just 3 PBMs, CVS, Express Scripts, and Optum Rx, and they control 80% of the prescription drug market. Throughout the years of consolidation, the largest PBMs either own or are owned by the nation's largest health insurers. Here's a breakdown. Aetna owns CVS, Cigna owns Express Scripts, and United Healthcare owns Optum Rx. Negotiating on behalf of health plans, employers, and other payers, PBMs extract billions of dollars from pharmaceutical manufacturers each year. To put a number on that, in 2023, rebates, discounts, and other payments made by manufacturers of prescription drugs to PBMs reached $356 billion. Those rebates are not getting passed down to the patients to lower drug costs. Not only are we seeing manufacturer rebates and discounts going through to boost PBMs' bottom lines, but the health insurance parent companies that also own these PBMs have moved to plans designed with large out-of-pocket cost-sharing arrangements like high deductibles and co-insurance. So how does Senate Bill 316 help Nevadans save money on prescription drugs? Before Kaylin walks you through the provisions of the bill, I want to explain how this bill will help Nevadans save money on prescription drugs and how we got to this particular version of the bill. I do want to thank all the stakeholders. I know that we've been meeting very regularly throughout session, and I know that some of the major stakeholders have been meeting with me in the past 18 months to work on provisions of this bill and what they look at. First, this bill reforms the way PBMs pass down rebates to patients, allowing them to continue to negotiate drug prices, but putting guardrails on their ability to siphon away rebate savings from patients. Through conversations with insurers and PBMs, we have been meticulous in making sure that PBMs will be able to still make money through contracts while the bulk of the savings are passed directly on to patients when they pick up their prescriptions. It was really important for me to see that this wasn't some like monolithic thing, that we were not able to see the actual savings when we went into our prescription counter to pick up prescriptions, but that Nevadans would be able to see that and feel that effect immediately from the provisions of this bill. Second, we made sure to go after the biggest part of the market and exclude good actors that are not for profit. By excluding self-insureds, Medicaid, PEB, and our other union ERISA plans, we are left with only for-profit companies in this bill. Part of the reasoning is when you look at like a plan like the Culinary Health Plan, or you look at a self-insured plan, or you look at Medicaid, they have a duty not to profit, but to the patients, to their employees, to the state. So when you look at Medicaid, their investment is going back into our state. It is going back into healthcare, and we know that. It's not like the state is profiting on this, any of these rebates or any of this like system. And so That is why we didn't include those kinds of plans in this bill. And this is meant to go after those for-profit insurance companies and PBMs that are there. When PBMs were created, the standard practice of business was to negotiate the drug price, receive a standard fee for each drug they negotiated, and our profit corporations no longer honor this, and we want to fix this and make sure the rebate is then used to actually lower the cost of the drug for the consumer. There's simply no reason that patients should be paying more for their prescription drugs than a PBM. 316 will also provide much-needed transparency. This bill requires a report from health insurance carriers and PBMs that will shed a light on how PBMs benefit from manufacturer rebates and discounts over patients. Lastly, this bill ensures that patients and doctors get the right to choose prescriptions that are right for them. By putting the duty of care in this bill, patients and their doctors will get to choose the right medicine for them and have that medicine covered. Add this with the fiduciary duty component, and patients will be put first. This is what has been accomplished in states like New York and Alaska, and I will assure you that these PBMs and insurance companies are still operating in those states. Again, thank you for your time today. I want to wrap up by acknowledging not only that not all PBMs are bad, and this bill does not get rid of PBMs, but I do think they play an important role in the overall delivery of our healthcare system. But I don't think there's anyone in this room that thinks we have a perfect healthcare system, or that there is one bill that is going to solve all of the problems in our healthcare system. But hopefully you will see that this is a bill that gives some added transparency, some needed guardrails on an industry that has become too powerful in our state, and it requires us to take such action to make sure that patients are seeing those savings. We are putting patients over shareholders, and that we are doing what's in the best interest of all Nevadans. And with that, I will turn this over to Kaylin now to go over some of the provisions of the bill.
Good afternoon, Chair Marzola and members of the committee. Kaylin Cardavani, Kardavani, and I am the Executive Director of New Day, Nevada. Thank you for taking the time to hear this piece of legislation. I'm going to go over kind of at a high level. I know that we are pressed for time and all of us are exhausted. So this bill is broken into 4 parts. Section 1 and 19 deal with transparency. There are strong reporting requirements for PBMs in this bill that will be given to our Division of Insurance, who currently manage their licensing. Sections 25, 27, 28, 30, 31, 32, 35, and 36 deal with rebate pass-through. SB 316 brings the payment model back to its original structure, which will allow for PBMs to still exist, but it limits the ability for them to pocket large sums of the rebate. This bill will require that 100% of the rebate, minus agreed upon fees and other required reimbursements, goes to benefit the patient, either at the point of sale at the pharmacy counter or through lowering their out-of-pocket cost-sharing obligations with their health insurer. Section 23 deals with duty of care. This piece is critical to making sure that patients get the right medicine for them. There are many different prescription drugs that treat the same ailments, and not every one of them is right for you. And so this provision will make sure that it is a choice between you and your doctor which drug is right for you, and it's not just what is cheaper for the PBM that push you towards. And then fiduciary duty. With duty of care, fiduciary duty raises the standard of care. This higher standard is essential in assuring an insurer's obligation and loyalties are to the patient and not the insurance company. Finally, I wanted to thank the sponsor and you all for hearing this bill. SB 316 is not about punishing business. It's about protecting patients. Thank you.
Does that end your presentation?
It does, and I realize that, Rochelle, and for the record, this is a super complicated topic, and a lot of people are just not familiar with PBMs. And I will tell you, I'm still learning things every single day about PBMs. For me, it came down to a couple of things that we realized. Currently, the way our structure is set up, in not only in statute but also is that when it comes to this duty of care, the primary person, the primary, organization is a shareholder. Like, they are they look at shareholders, and that's where their primary duty of care is too. And this shifts that to say, hey, first you need to look at the patient, and then you need to look at the shareholders, especially when it comes to life-saving healthcare and driving down some of those costs. So those are some of the important things. We did take a lot of initial language through the process of negotiation. Like I said, this is not a perfect bill, but this is meant to be a first step in addressing some of the problematic, non-transparent issues that we have in our healthcare system. And we are ready for any questions you might have.
Thank you for being here today in your presentation. And before I pass it to the committee members, could you just walk us through what happens right now with the rebates? What happens from the pharmacy, from the warehouse to the patient?
Yeah, Kaylin Cardavani for the record. I think I have a couple answers for that. One, I think this is a part of the transparency piece, is we're not entirely sure how much of the rebate is being pocketed by the PBM before it's given to the insurer and then the patient. So we're not 100% sure. So that's where the transparency piece comes in. I guess the second part of that.
I think I can take on a little bit, just give you a very high-level overview of what we do know. So you have drug manufacturers, so like pharmaceutical companies, and I'm not trying to be condescending when I'm describing this how a bill becomes a law, but I know that this is how I kind of learned how this process worked, is you have pharmaceutical companies. They do the research. They have the scientists. They research, they develop, they test, they manufacture a drug. So you have those drug manufacturers. PBMs are often on behalf of the insurer that they may either work for or owned by. Most of the time owned by, like I said, there's only 3 of them. They administer pharmaceutical benefits for health plans. They create formularies, they negotiate prices, discounts, and rebates. So they decide, here are the drugs we're going to offer our plan members. We are going to do this, in this case, with our first duty to shareholders on how we are going to make that the least expensive. And we are going to collect and we are going to make a list of the drugs that we are going to offer our insurance, our insurees. The drug wholesaler provides that drug to a pharmacy or a provider, which we've learned is the same person that's negotiating the drug price. So it's moving down that middle ladder. So the entire middle part of the ladder is owned by the same people. And then the patient picks up and pays for their drug that's included on their plan. So if there is some dispute, let's say there's 2 drugs and you know that your doctor says, this is the drug you need and it's not included on your plan. Right now, you have to go to a certain pharmacy. You have to get a certain drug and you don't have options to those because the first and foremost duty is to the shareholder and not the patient. So that's kind of a little high-level overview on how the drug goes from being made and researched and developed through those middlemen all the way down to the patient where they pick it up at the pharmacy.
Thank you, I appreciate that. And I wanted to make sure that, especially for the new members of the committee, that was explained. And with that, we'll move to questions. Assemblymember Kasama.
Thank you so much for bringing this really critical bill. I think we all know our constituents are asking for changes, and so excited to see that this is here. My question is, how is you talked about, let's see where I had my note here, the savings that will go to the patient. And so my question is, I think you said it might be a lower copay for the drug or at the counter at the pharmacy. Can you just maybe elaborate a little bit on that? What would that look like? Is it just an immediate, anyway, I think you understand what I'm saying, how will that work?
Yeah, Kaylin Cardavani for the record. So in this bill, the language is kind of modeled after Arkansas, where we see a direct savings. So they were looking at asthma drugs. So when you went to buy them at the pharmacy, they were seeing an average savings of $500 a year. So how it works is the PBM negotiates that price with the manufacturers, the drug manufacturers. Once they collect their already contracted fees, then directly that cost or that rebate from the savings of that drug get passed on at the pharmacy counter to that patient, if that makes sense.
So they just pay less when they go to pick it up?
Yes.
Okay.
Assemblymember Cole.
Thank you, Chair. Appreciate it. And thank you for bringing this. I agree with my colleague that we heard this at the door over and over and over again, right? So walking back to sort of where you were talking about sort of the overall things, right? So as I understand it, PBMs manage and administer those rebates on behalf of consumers, theoretically, right? I know this shareholder thing. And then pharma is the entity that pays PBMs the rebate, and there's an administrative fee there as well, right? So I guess my question is in section 13, where we define rebate. And we say rebate means any discount, remuneration, or other payment paid by manufacturer. So my question is, does the remuneration or other payment paid, does that include that administrative fee? Because it's just kind of broad.
Kaylin Cardavani, for the record. Sorry, I think I'm going to try and answer what I understand is your question. So it does, and the reason we have that language in there is to make sure that PBMs aren't getting around it. So in some states, it hasn't been as strong of language of how they get their fees. So they're still contracting, and they're still able to collect their fees with that contract rather than trying to kind of inflate what the net price of the drug is to pocket more of that rebate. And so that is why we have that language kind of capturing all of that payment instead of just having it be the contracted rate. We wanted to be very specific.
Rochelle Nguyen, for the record. It was language that I know that there were some opponents of this bill that wanted us to take out that language. And what we found is that language needed to be in there because it would allow like a loophole for PBMs to be able to claim that their administrative fees, I guess, were higher. And so we would get less of that pass-through rebate back down to the actual patients. I don't know if that answers your question.
Can I just maybe get legal to clarify that that is accurate? Mm-hmm. Thank you.
Thank you, Madam Chair. Sam Quas, Committee Counsel. I believe that would be accurate unless the fee that you're referring to is one of these bona fide service fees as defined under federal law, which is specifically included within the definition as something that is not included in the definition of rebate.
Assemblymember Torres Fawcett.
Thank you, Chair. And thank you so much for the presentation. And Senator Nguyen, it's good to see you for at least the second or third time today. I had a specific question just on where where the benefit is. It seems to me that this is going to be a direct cost savings for the consumer. Can you clarify that? So it's like money that right now is being saved for a different entity. And so with this piece of legislation, it'll change that savings to the consumer, which will allow for everyday Nevadans to have better access to affordable prescriptions. Is that correct?
Rochelle Nguyen, I couldn't say it any better. I think it was a fitting example when we looked at the data coming out of Arkansas after 3 years of having, it was Arkansas, right? Yeah. Arkansas, after 3 years of having this similar language in place, and it was telling that they were using like asthma medication because, as we all know, having heard this in many policy committees, one of the number one things that Nevadans are suffering, especially children, for various reasons, have to do with asthma and other like lung and health related issues. And so it was a good example to see that on average, each customer we're seeing a $400 decrease at the prescription counter when they were paying for their prescriptions. So that is our intention. That is what we've seen happen in another state that had similar language. And that's what we're hoping will happen here in the state of Nevada. I think the argument that is made and why you would not want to pass it down to the consumer and you would want to maintain that duty to a shareholder is the argument is they are going to be able to pocket more money together collectively to drive down premium costs for insurers. And that would be fine, and that's why I'm okay with it for plans like Medicaid and PEB and ERISA plans because are these self-funded county plans because they don't have a profit margin that they are trying to make. And so there's no duty to a patient to make sure that it is actually driving down insurance premiums by giving them the money instead of directly to the patient through this rebate pass-through.
Thank you. I appreciate that because it seems to me like the issue that exists right now is that cost saving is not necessarily transferred down to the patient. And as somebody who's had to purchase some of that medication that can get extremely expensive, I can see a direct saving. Do we know for individuals that maybe have a condition like asthma or diabetes, like how much they would be saving each month or each year?
I think that's the data collection piece that we have in there. The reporting requirements that, Rochelle went for the record, are super important here. I think we are going to have a window into how these PBMs operate, where that money is ultimately passing through, where we can potentially capture even more savings for patients, and what we can do to do that. It's a pretty long on-ramp. I think it's like a 2-year kind of rollout, and Kaylin might be able to expand more on that as well.
Yeah, Kaylin Cardavani. So in part of our negotiations, it will have a start or effective date of January 1st, 2028. This is so that our insurance companies can plan, figure out what they need to do, and there's not this just kind of chaos and upon immediate implementation.
Committee members, any additional questions? I don't see any. If you want to step back, please. We will start with support testimony of Senate Bill 316. Is there anyone in Carson City wishing to testify in support? Please remember to state and spell your name for the record. You may begin when you're ready.
Madam Chair, members of the committee, for the record, my name is Paige Barnes with the Ferretto Company, here today on behalf of the Nevada Society of Dermatology and Dermatologic Surgery. We are here in support of SB 316. We believe that this piece of legislation brings transparency to the system, prioritizes patients, and supports the relationship between a patient and their physician. We urge your support of SB 316. Thank you.
Good morning, Chair Marzola and members of the committee. For the record, Liz McMiniman, Retail Association in Nevada. Many of you have seen my face before on this very issue, and I am very grateful for the senator for bringing this legislation forward. And first of all, I had prepared notes that I wanted to read, but first of all, I want to go back for my own personal experience with PBMs, because I was a proponent of PBMs initially over 20 years ago. I thought that this was going to be the new boon to help bring down drug prices in the state of Nevada and across the United States for the patients that need their medication. In the last couple of years, after doing a deeper dive, have realized that they have driven the prices up over the last 20-something years to a point that it's very detrimental. One of the things we talk about, how they're hurting patients and how they're harming the whole market for medication. But one of the other ways, most notably, is by putting trusted community pharmacies, which I represent, out of business and forcing Nevadans to travel many miles to fill their prescriptions by steering them to their very own pharmacies. The Federal Trade Commission examined reimbursement for 2 drugs, found that PBMs paid their affiliated pharmacies 20 to 40 times more than the national average drug acquisition cost. In some cases, the independents, or the smaller pharmacies, actually lose money every time a patient fills a prescription due to PBM clawbacks and fees. This perverse application within the healthcare field for our patients in Nevada needs more transparency. We fully support this. I know, as the senator said, it's not a perfect bill. It's a start. I think Nevada owes their patients that legislation. And thank you for listening and hearing the testimony this morning.
Thank you for your testimony.
Good afternoon, Madam Chair, members of the committee. My name is Jennifer Lanahan with Western Public Affairs, here on behalf of the Nevada Pharmacy Alliance. The Nevada Pharmacy Alliance represents patients, seniors, providers, and pharmacists, and we advocate for accessible medications and affordable medications as well. Nearly 95% of all prescriptions filled in the United States are from just 6 PBMs, and they use this power to drive up costs through opaque rebate structures and restrictive drug formularies. Meanwhile, ordinary people are being forced to skip treatments, to ration their medications, also to simply give up sometimes because they can't afford to pay for their prescriptions. SB 316 is legislation that will finally set us on a path toward ending the PBM's ability to exploit Nevada's healthcare system for the mere sake of financial gain for the few. Thank you for your support, hopefully, on this bill, and thank you for the time.
Thank you for your testimony. Is there anyone else in Carson City wishing to testify in support? I don't see anyone. I don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
To testify in support for Senate Bill 316, please press *9 to take your place in the queue. Chair, the public lines are open and working. We have no callers choosing to testify in support.
Thank you. We will move to testimony in opposition of Senate Bill 316. Is there anyone in Carson City wishing to testify in opposition? Please remember to state and spell your name for the record. You each have 2 minutes.
All right. Thank you, Madam Chair, members of the committee. Paul Young, on behalf of Farm School Care Managers Association. Thank you for the opportunity to respectfully oppose SB 316 today. We're not opposed. PCMA is not opposed to transparency and oversight. I will not walk through all the concerns of the entirety of the bill. I'll focus on a couple key portions that are our highest concerns. PBMs negotiate rebates with manufacturers, and the rebates, if chosen by the employer, are passed through 100% to the consumers. Further, PBMs have teams solely focused on administering and managing those rebates on behalf of the consumers. The consumers do not pay PBMs for this service. Manufacturers do, and our concern focus on this relationship. One, if the definition of the rebates in SB 316 remain as is, manufacturers will be able to refuse to continue paying the rebate administration fee. So although 100% of the rebates are passed through to the consumers, which we do not oppose, so we will the rebate administrative fee. We will oppose the rebate administrative fee. This means the consumers will face an $8 to $10 administration fee per claim. To the result of the passing through the administration fee to the health plan, consumers will face a higher premium, and our cost sharing, SB 316's language on cost sharing shields manufacturers while increasing the higher out-of-pocket expenses for consumers. While the proponents have informed us that the rebate administration fee is not part of the rebate definition and is excluded as bona fide service under 42 CFR section 447.502, we wanted to make sure that this was the understanding. However, I believe LCB clarified that in earlier testimony. We look forward to continued discussion on the impact of those three main concerns of SB 316, in addition to the language we've offered that will help mitigate the increased costs on consumers. Thank you, Madam Chair.
Good afternoon, Chair Marzola and Committee. Shelley Capro, representing the Nevada Association of Health Plans. The state trade, which has 11 members, does oppose SB 316 because the bill will increase costs for health plans, and this cost increase will only be passed on to our members. We are also concerned with the legal and operational challenges that health plans may face as a result of expanding the fiduciary duty past our health plans. I'd like to highlight three key areas of concerns. We do not oppose 100% pass-throughs of rebates. Currently, we and our enrollees do not pay PBMs an administration fee to manage the rebates and the processing of the rebates on our behalf. The rebate administrative fee is paid by manufacturers. We worry that if manufacturers are no longer required to pay PBMs a fee to administer rebates, we will have to bear that cost. This cost would shift directly to enrollees who currently receive the service at no cost. This cost shift will result in higher premiums and increased out-of-pocket expenses for our enrollees. We are concerned that the current definition of rebates and provisions on cost sharing of SB 316 unintentionally shields manufacturers while exposing our enrollees to higher financial burdens. If this rebate administration fee is excluded from the definition, as proponents have provided, we want to be clear that this is the understanding across all stakeholders so that the interpretation doesn't change in the future. Finally, SB 316's expanded fiduciary duty provision places us in a legally ambiguous and uncertain position. Since this provision would require PBMs to simultaneously prioritize the interests of health plans, enrollees, and employers, we are concerned that this will only increase litigation and compliance challenges for our health plan members. We are committed to continuing working collaboratively with the sponsor and stakeholders on language that would preserve transparency while avoiding unintended cost increases for our health plan members and their enrollees. As the sponsor noted, this litigation only impacts one piece of the supply chain. We need comprehensive legislation that touches on all parts of the supply chain.
Thank you, Madam Chair. Good afternoon. For the record, Trey Abney, representing America's Health Insurance Plans, otherwise known as AHIP. I will associate myself with the comments made before me. I wish I could spend the whole 2 minutes and just repeat over and over again that drug manufacturers set the price of drugs. Drug manufacturers set the price of drugs. PBMs work to negotiate with those drug manufacturers to reduce the price of drugs that you pay. Number two, the clients, PBM's clients are employers whose their purpose is to reduce the price of drugs for their employees on their health insurance plans, not shareholders. Finally, on rebates, rebate proposals have repeatedly been found to have a high price tag and eliminates the shared savings currently enjoyed by all enrollees from rebates and instead directs health plans to pass on those savings only to patients taking specific medications. In the United States, 9 out of 10 prescriptions filled are for generic drugs. This bill will not help those patients, nor those patients who take brand name drugs without therapeutic competition because rebates are generally not offered for those drugs. The California Health Benefits Review Program estimated that this would a bill like this would increase health insurance premiums by $200 million annually. And when a similar mandate was adopted in Medicare Part D, CMS's own actuaries estimated that would increase premiums by 25% and cost taxpayers between $200 and $400 billion. That's a national number. Madam Chair, we continue, we hope to continue to negotiate with the proponents of this bill. We met last on Thursday. We were waiting for language. It's been 48 hours since we've heard back from them, and we hope we can continue and get some language from them and work out a deal. Thank you.
Thank you for your testimony. Is there anyone else in Carson City wishing to testify in opposition? I don't see anyone. There's no one in Las Vegas. Broadcast, is there anyone on the line?
To testify in opposition to Senate Bill 316, please press star 9 to take your place in the queue. Chair, we have no callers for opposition at this time.
Thank you. We'll move to neutral testimony. Is there anyone in Carson City wishing to testify in neutral? You may begin when you're ready.
Thank you, Madam Chair, members of the committee. Adam Plain, P-L-A-I-N, with the Nevada Division of Insurance. The division's neutral on Senate Bill 316 as a matter of policy. Our stance is if you'd like us to regulate this, we will happily do so. We've always said we just need the resources. I wanted to be up here. I know this is not a fiscal committee, it's a policy committee, but wanted to try to establish a legislative record because I think this has been a little bit of a slippery fish for us, trying to get a hold of what's going on. The division did submit a fiscal note on the bill as it was introduced. The bill was amended in the Senate Finance Committee on May 13th, and as a result of the amendment, we withdrew our fiscal note. Then on the May 19th Senate Finance work session, I believe that amendment was officially adopted with the note that our fiscal note had been withdrawn. Then on the May 23rd Senate Finance work session, the amendment was rescinded and a new amendment was placed. And I don't know that the fiscal note impact was directly addressed in that work session, and then it was rescinded and replaced a couple more times. I did speak with Senator Wynn, and she said the bill was processed with the understanding that the fiscal note was attached, is my understanding, but I'm not sure the record was super clear, so I just wanted to present that. So if the division does have to come to present a work program during the interim, that we all understand that the fiscal note was attached, it was removed, and I believe it has been attached and processed. And I'd be happy to answer any questions.
Members, are there any questions? I don't think so, but thank you so much. Do you have a question? Vice Chair Howdigi? Thank you. Is there anyone else in Carson City wishing to testify in neutral? I don't see anyone. No one's in Las Vegas. Broadcast, is there anyone on the line?
To testify in neutral to Senate Bill 316, please press star 9 or raise your hand in the Zoom window to take your place in the queue.
Hello, my name is Giselle Ozuna. I am a resident of Las Vegas. I support this bill because my father has experienced many issues being an outdoor construction worker. Oh,
Ma'am?
sorry, give me 1 second. Yes.
Are you calling in for Senate Bill 316?
I'm calling for the outdoor workers bill. I might be in the wrong one. I'm so sorry.
You are. That's okay. Thank you.
Okay. Thank you.
Broadcast, is there anyone else on the line?
Chair, we have no callers for neutral.
Thank you. Senator, would you like to give any closing remarks?
Rochelle Nguyen, thank you. Just briefly, there were some questions about fees. Just to give you some perspective, the way that this is so complicated is a lot of times we hear about like real estate fees or like other like types of junk fees and other things in here. There are at least like 20 fees that PBMs charge that we're aware of, and there could be potentially more. So just to give you an example of that, this has gone through a long process. There is one amendment that was adopted. We rescinded multiple amendments, so there is only one amendment that was adopted. It is the one that is before you today in this reprint. There is a fiscal note. It is the teeth, I guess, in the bill to be able to make sure that Adam Plain and his division can make sure that they are collecting these reports and enforcing, so the teeth of the bill, to make sure they are. I believe it's around 4 employees and it's around $900,000, and it's included on Nellis. And it was something that was included when we work sessioned it out of Senate Finance, and that would be our intention. So if I want to make sure that there's a clear record of that, so if they do come back for a work session and this bill has the ability to get the support of this committee as well as the Assembly floor and get a signature at the governor's desk, that would be included. So if you have any other questions about that, please let me know.
We do have a question. Assemblymember Kasama.
Chair, thank you for the indulgence of an additional question. Does this bill address which pharmacy you can go to, so it's no longer required for, I don't know if this bill covers that, because I know that's been a concern of an area as well, that some of the insurance companies are just driving it to certain pharmacies. Does this provide for flexibility there?
Rochelle Nguyen, for the record. Let me just take a look at my notes. I know that during my initial presentation in the Senate, one of the big provisions that we were trying to avoid is this mandatory like steering towards like certain pharmacies. And yeah, if you look at Section 15 of this bill, it still prohibits a pharmacy benefit manager or PBM that manages a pharmacy benefits plan, which provides coverage through a network requiring a person to use a pharmacy affiliated with that PBM.
Great.
So it allows you to use your prescription, your pharmacy.
Thank you so much.
I don't see any other questions. Thank you so much for being with us today. I will now close the hearing on Senate Bill 316. As we stated earlier, per Speaker Yeager, he did state that the 24-hour rule is waived, and so we are going to go into a work session of Senate Bill 316. We will not rehear the bill or the explanation because we just heard it. So is there any questions, members, on Senate Bill 316? I don't see any. I will take a motion.
Move to do pass as amended.
I have a first from Vice Chair Howdigy. Just do pass. But it's not here.
Just do pass. Yeah.
Move to do pass.
I have a first from Vice Chair Howdigy. Is there a second? I have a second from Assemblymember Miller. Is there any discussion on the motion? Assemblymember Cole.
Thank you, Chair. I just want to note I'm going to be a yes reserved. Thank you.
Any further discussion? I don't see any. All those in favor say aye. Aye. All those opposed say nay. Motion carries. I'll assign that floor statement to Assemblymember Miller. Thank you, Chair. And with that, we will close our work session. I will now open the hearing on Senate Bill 260, which revises provisions relating to air quality. Welcome back, Senator Flores. You may begin when you're ready.
All right, thank you, Madam Chair, for allowing me to get a hold of my bearings here. Good afternoon, everyone. Madam Chair, Vice Chair, esteemed colleagues. I am Senator Edgar Flores, proudly representing Senate District 2, Northeast Las Vegas, and I'm here proudly to present Senate Bill 260. I'm joined by Ms. Jackie Spicer, who is with the Nevada Environmental Justice Coalition. I wanted to start off and just preface that I intend for us to quickly move through the bill, but I needed to recognize and thank Mr. Paul Maracan for leading months of meetings, conversations, negotiations over coffee, over rooms as full of the amount of humans we have in this room here. We started in polar opposites of the conversation, and because of Paul and Ms. Spicer, relentless work, and after 40 different revisions, we've arrived to the place we are today. So I just wanted to recognize them for that, because it's easy to want to give up in a negotiation when we're having a hard time finding that middle ground, and I just wanted to thank them publicly for their tremendous work and professionalism. When we originally started this bill, like many of you during the interim, we were trying to identify issues that we think are important to Nevada and that we felt we needed to address. Particularly when we talk about air quality in the state of Nevada, we've all been in that situation where unfortunately we see the wildfires. And there's two things that happen when we look out the door and we see these wildfires. Number one is we still have to complete a job. We have an obligation to take care of a project, to take care of our families, to get paid. And then on the other side is our health. And one of the things that we wanted to do with this bill is find a middle ground where we don't compromise one over the other, that we can succeed and complete the objective and do it in a way that we are not putting ourselves in harm's way. So when we originally started the bill, we wanted to provide direction as a state and say, look, when the air quality hits 150, we want certain things to occur. When it hits 200, we want different things to occur. And we were also dictating work stoppages when it's just absolutely impossible for you to be out there and working in those conditions. But after getting a lot of feedback, we got to this amendment and we realized that perhaps we can send this back to OSHA and allow them to really work with the entire breadth of every single industry and allow them to dissect individually each industry and figure out what makes sense in that approach. We also wanted to make sure that, as we saw in the wildfires in California, that we created certain exemptions, because we know that even if there's a wildfire, we still need to make sure everybody's getting electricity, water, gas, et cetera, et cetera, et cetera. So we wanted to create carve-outs for that. So you'll see carve-outs in here that are specifically for that purpose, or anybody that provides emergency services, firefighters, law enforcement, et cetera. So that's how we got here. I'm going to hand it over to Ms. Spicer just to very quickly walk you through the actual amendment And if you have any questions, we'll be open for questions at that time. Ms. Spicer, please.
Thank you, Chair and members of the committee, for having us here today. My name is Jackie Spicer, for the record, representing the Nevada Environmental Justice Coalition. I want to thank Senator Flores for including me in this, and also to say, just to give a little bit of context, that Nevada is the driest state in the nation, and our arid conditions combined with rising temperatures make us extremely at risk, as well as our surrounding states, for worsening wildfire conditions that are becoming more frequent, more severe, and lasting longer every year. Smoke from wildfires contains fine particulate matter, which is a harmful and dangerous pollutant that can enter our bloodstream and trigger serious respiratory and cardiovascular health problems. So it is a really serious issue that we're trying to tackle here. And Senate Bill 260 intends to protect the safety and well-being of outdoor workers. And in doing that, what this bill states is that we're directing the Division of Industrial Relations to create regulations for how employers will monitor air quality levels caused by wildfire smoke and reduce exposure at unhealthy AQI levels of 150 or greater, as well as hazardous air quality index levels at 200 or greater. This also ensures a communication system and training for employees so they are aware of the risks that they would be taking when they continue to work, and also determines at which air quality index level that for wildfire smoke that an employer shall not allow an employee to continue working outdoors when things like an N95 mask or however these regulations come out, those minimum protections would not be able to protect workers at extreme levels. So with that, we have included that the Division of Industrial Relations may or shall develop guidance to employers. So once these are created, employers will have the ability to not only have input on how these regulations are created, but also receive guidance on how to implement them, as well as guidance on how we can tackle this in respect to rural and remote locations as well. So with that, we do believe that this is an important step to protect workers and also ensure that employers have the guidance on how to respond in this type of extreme weather.
And Madam Chair, if I may add one brief point, Senator Edgar Flores, for the record, we want to make it abundantly clear that we are simply asking that they decide what happens at 150, 200. We are not giving them specific direction on how to do that. They will figure that out. And that's just important because I know that there's folks that have brought up questions, well, how are we going to achieve this objective or that objective? We just want to make it abundantly clear that we will have the input of all the stakeholders during that regulatory process to come up with that. So at this time, we don't know if monitoring the air will be done via websites that we're all so accustomed to using now, or if we're going to purchase actual devices. You know, none of that is set in stone. We don't know what that looks like. We may set different standards depending on the type of industry. And I just wanted to make that abundantly clear because I know that's one of the biggest concerns, that we can't treat all industries the same, but that's the whole point of sending it back to them to allow them to address that specific issue. Thank you, Madam Chair.
Thank you, and thank you for your presentation. We will start with Assemblymember Carter.
Thank you, Chair. How does this apply to public utilities?
We did contact the folks at the IBEW to ask and
Can you
ensure.
please state your name for the record?
My name is Jackie Spicer, for the record. We did speak with folks at the IBEW to ensure that they felt the language about the exclusion for emergency workers. It doesn't restrict them from continuing to be able to do their job. Does that answer your question?
Follow-up. And my concern is about all of the utilities, including the natural gas and the like, and about the fact that it talks about declared emergency. And there's a lot of times when these utility workers need to get into an area, need to do things for life safety and stuff, when there's not a declared emergency. And that's what I'm trying to get at does this still apply, or is there an exemption for utilities, public utilities?
Thank you for that question, Senator Edgar Flores, for the record. Assemblymember Carter. So it is our intent, and in the regulatory process, they will have an opportunity to do that, but it is our intent for all of that. I mean, we think of cell phone towers, for example. We need to make sure that we can communicate. So we can go down the list of everything that is essential. It is our intent for them to be able to continue to do their work. And it's the expectation of, I think, the stakeholders also. So I just wanted to make that abundantly clear again, that that is our intent, that was the objective, and that's why we specifically try to create some of these carve-outs to make that abundantly clear. And thank you for allowing me to get that on the record, because that is incredibly important.
Thank you.
Assemblymember Miller.
Thank you so much, Chair. Senator, my question is more about the air quality index that you state in here. So not so much, I understand that this bill is focused primarily for employment, but we know that, especially a few years ago, when those bad forest fires were happening, especially up here north, like schools were having to close. It was really tragic. And in the South, we haven't had to close schools, but we've had many days where students can't go outside for recess, students can't go out for PE and such. So I'm just curious to see if these same air quality indexes, because I know that was based on adults working outside, but would this still apply to like students in schools, where it could still kind of be a standard that we could develop policies within the schools based on these indexes?
Thank you for that question, Assemblymember. Senator Edgar Flores, for the record. This would not apply to indoor workers and/or schools. This would be specifically for folk who are outdoor workers. With that said, we do know for a fact now that anybody that lives in the north will tell you the amount of times in a year, and sometimes it's not that many times, but people can't even go to school. And I like that you made that point, only to make my point that that's why we thought it was so important, that if we think it's so dangerous that we can't even have a child inside of a building, imagine for the humans outside. So it is not our intent with this bill to capture that particular group or schools or anything like that. My understanding is the school districts already have standards, and my understanding is that those standards, I think, are better than what we are doing here, if I'm not mistaken.
Thank you, Chair, because I wasn't implying, I didn't think you wanted to amend right now at this late state in the game. But I just wanted to know if those same standards, like the 150, the 200, but you're saying for students it may be lower, tighter?
If I'm not mistaken, I think Senator Edgar Flores, for the record, I think the school district might have a standard that's tighter than that, yes.
Thank you so much.
Assemblymember Cole.
Thank you, Chair. Thank you for bringing this. I do appreciate changing this into more of a regulation standpoint. I know the heat mitigation stuff that was happening, and that was a process of iterative, right? Workshops and everything, so really dialing it in for industries. So I guess my question is, as I understand the intent of this, is to make sure that those employees who maybe have health conditions and health problems really understand what the air quality looks like and they're exposed to it and what they should be doing. But I guess my question, I have the weather app up, right? And it gives me all of this information on the air quality index, PM 2.5, sulfur dioxide, carbon monoxide. So I'm just wondering, isn't that information already readily available on somebody's phone? Because we're putting in a communications requirement here for the employer to have to do training and tell them these issues. And I'm just wondering, can't they do it themselves? Thank you.
Jackie Spicer for the record. Yes, we do think that this information is easily accessible and available on people's phones, watches, where they can find it. However, we did get a lot of feedback, especially related to how workers or members of the public may have reacted to requirements for masks during COVID, that people may not have felt comfortable for whatever reason. And so at the very least, we want to make sure that people are educated on the risks that they would be taking if they were to choose not to use the personal protective equipment that would be outlined in the regulations.
And if I may add, Madam Chair, Senator Edgar Flores, for the record, Assemblymember Cole, one of the questions that has often come to light is what happens if I have 40 people working on a particular job site, but it's several miles in range. because, or not the same job site, but I have 40 people where this particular group in this particular area of town may be exposed to a certain air quality, but the other group isn't. Or what happens when there's a lot of wind and the air quality all of a sudden shifts. That's why we felt it was so important for us to take it to the regulatory process so that we can really flush that out. How long does the air quality have to be persistent before you have to trigger a work stoppage, or before you have to trigger that the protective gear be provided? So all those were the type of nuances that we wanted to make sure that we allowed the regulatory process to address. But it is our position, as you've indicated, because one of the concerns by many industries is, do I have to carry a monitoring device in my hand? Right? That could be expensive or complicated or whatever it may be. And we also have that position that you have, which is you don't have to do all that. You can usually just plug in a website and you usually have a good indicator of what the air quality is like. So we agree with you that we think that there's going to be kind of a common sense approach to a lot of this, because they'll be able to utilize things like different websites to really get a grasp of what the air quality index is in that particular region or area.
Assemblymember Anderson.
Thank you, Chair, and was trying to remember a few things too. Thank you for bringing this forward. I think it's very important, and I'm happy that you guys mentioned the Northern Nevada connection, because I think it also happens in Southern Nevada as well. Though there are some private industries that maybe they are involved with some contractors or some highway construction sites that are not necessarily public employees. They are private employees, but many times they might have other special, like emergency type of situations. For example, the Davis fire that just happened up here, that when we drive by, we see the remnants of still. Would they still be, how would they be handled in this language or this law at this time? Or would that be something that you would think would be able to be part of the regulations?
Thank you for that question, Assemblymember Anderson. Senator Edgar Flores, for the record. Yeah, I think particularly in horizontal construction projects, one of the questions that we often, and we had in the very onset of these negotiations, is what if I'm pouring concrete, right? And I'm dropping thousands and thousands of dollars of concrete, and all of a sudden the air quality index is very poor. Are we expected to just let all that material go to waste and run away, or maybe create another hazard by leaving that material there? So they for sure brought up those types of concerns, which is why we ultimately opted to really listen to the concerns of the opposition at the beginning and go in this direction so that we could really flesh out those type of scenarios specifically. So the way we see it playing out is those industries specifically, and I'm going to use concrete as an example, I'm sure those industries will sit down at the table and say, here's how we operate, here's the typical hours of operation, here's how much material we're typically pouring. We want to make sure that we allow ourselves to maybe respond differently than, say, somebody who's just out there maybe doing garbage cleanup, right? Two different scenarios, and we want to give each different industry an opportunity to give that input so that we have common sense regs that really apply more to the industry rather than the entire a group of Nevadan kind of stakeholders. Yeah.
And thank you for that, because I think that is an excellent example of when's the right time to pour concrete. But in this case, this has to do with an emergency situation where there is a fire that's happening. All of our firefighters, all of our forestry services are already out. And there are other trucks that are actually, let's see, with the, that could be, don't want to use specifics, but I will, forget it, Granite, who might have those other, I guess, vehicles and or crews that can help fight it. Would they still be, I mean, how would they be impacted by this rule, by this law? I guess it's kind of building off of my colleagues, Assemblymember Carter's question. Would they be in this same position of, well, you're protected or not? Does that make sense what I'm asking?
Yeah, no. Thank you, Assemblymember Anderson, Senator Edgar Flores, for the record. It is our intent that in the regulatory process that we flesh out those protections. And I want to be careful with the word protections. I would say the liability side of it, where we want to make sure that we flush out the liability side of it, where we're not inadvertently holding an employer to a standard when they're providing an emergency service type of product or service or work. So that is the objective, 100%. And NV Energy reached out with these type of questions. AT&T reached out with these type of questions. And just to make it abundantly clear, it is our objective that in the regulatory process that we allow for those type of carve-outs to protect those particular type of stakeholders, because in no way would we ever want to get in. And we were even talking about in the situations where we have a volunteer rescue group or a paid rescue group, right? They may not be a public entity or law enforcement or firefighters, but we do want to create it in that regulatory process and give them the flexibility to kind of create that, whatever they believe is the best way to approach that.
Committee members, any additional questions? I don't see any. If you guys want to step back for a moment, we will start with support testimony of Senate Bill 260. We will start in Carson City. Please remember to state and spell your name for the record. You may begin when you're ready.
Good afternoon, Chair Marzola, members of the committee. For the record, Carlos Hernandez, representing the Nevada State AFL-CIO. We are in full support of Senate Bill 260. Thank you.
Good afternoon, Chair and members of the committee. My name is Cassie Charles on behalf of the American Federation of State, County, and Municipal Employees. We are here in strong support of SB 260. We support keeping public workers safe in situations where there is poor air quality and support OSHA in developing the regulations to that effect. Thank you.
Thank you, Chair and members of the committee. My name is Olivia Tanager on behalf of the Sierra Club Toyabe chapter. We are here in full support of SB 260 and I appreciate the time to have this bill heard today. As Ms. Spicer stated, our air quality is only getting worse. And as you heard Senator Wynn say in the previous hearing, our population here in Nevada has a higher than average asthma. And so we know that air quality is something that is affecting many Nevadans and many Nevadans' health. So we support OSHA developing the regulations to protect Nevadans from poor air quality. I do want to be really clear, we brought legislation last session to deal with both heat and air quality. I appreciate Senator Flores working on that piece of legislation, and then we ultimately ended up going through the regulatory process to adopt heat regulations. We have not yet had a full summer since those regulations have gone into place, and so we're looking forward to seeing how the regulatory process plays out here. But ultimately, we really need to protect workers in this state. My organization is committed to doing that, and I appreciate all of y'all's commitment to supporting outdoor workers. But I hope in future sessions we can think of bigger and bolder ways that we can continue to protect workers. And so with that, we urge your support for SB 260. Thank you.
Good afternoon, Honorable Chair and Committee. For the record, my name is Wendy Colborn, Chief of Staff for the Northern Nevada Building Trades Council, and we are also in full support of SB 260 and urge you to support it as well. Thank you so much.
Good afternoon, Chair and members of the committee. My name is Tristan St. Dennis. I am the Policy Associate with the Nevada Conservation League. I just wanted to echo the sentiments of our other colleagues, and we urge your support. Thank you.
Is there anyone else in Carson City wishing to testify in support? I don't see anyone. There's no one in Las Vegas. Broadcast, is there anyone on the line?
To provide testimony in support of Senate Bill 260, please press star 9 now to join the queue.
Hello, my name is Giselle Zuna. I'm a resident of Las Vegas. My father is an outdoor worker in Reno, Nevada. He's also worked in Las Vegas in the heat and extreme weather conditions. Every year when there are wildfires up in Reno, he has to work through those conditions and has been to the ER multiple times because of his asthma. My father is 65 years old and still working outside. And so it's for people like him, as an immigrant daughter, as someone who has seen how this issue has affected many BIPOC communities, I urge you to support this bill. Thank you so much.
Good afternoon, Chair and members of the committee. For the record, my name is Tara Webster. On behalf of the Progressive Leadership Alliance of Nevada, the preventative measures proposed in SB 260 are essential to protecting workers, preparing businesses, and fostering healthier, more resilient communities. And that's why it's crucial to take timely action during extreme weather events to prevent health issues and promote a strong culture of safety in outdoor work environments. That's why we strongly encourage a yes vote on Senate Bill 260. Thank you.
Chair, we have no additional callers in support.
Thank you. We will move to testimony in opposition of Senate Bill 260. Is there anyone in Carson City wishing to testify in opposition?
Hi, committee members. Victoria Supple, representing the Nevada Builders Alliance today. We appreciate the intent of Senate Bill 260 and thank Senator Flores for bringing the discussion forward regarding workplace safety with wildfire smoke. However, we are opposed to this bill as it requires onerous daily reporting requirements for protections that are already addressed through OSHA guidelines. We feel this is an undue burden placed wrongly on builders and Nevada businesses and urge you to vote no on Senate Bill 260.
Thank you for your testimony. Is there anyone else in Carson City wishing to testify in opposition? I don't see anyone. In Las Vegas, are you wishing to testify in opposition of Senate Bill 260?
Yes, Chair Marzola, thank you so much. Sorry for the rush.
That's okay. You may begin when you're ready.
Yes, my name is Anahit Baghshetian. For the record, that's spelled ANAHIT and I'm a policy analyst at Nevada Policy. Although we appreciate all the amendments and the changes that the bill has gone through, we still remain in opposition as we believe that this would open a door for bigger and harder regulations on businesses that are specifically located or relocating to Nevada for a lighter business climate. And for those reasons, we ask you to oppose the bill as well. Thank you so much.
Thank you. I don't see anyone else in Las Vegas. Broadcast, is there anyone on the line wishing to testify in opposition of Senate Bill 260?
To provide testimony in opposition to Senate Bill 260, please press star 9 to join the queue.
Hello, this is Bonnie Little. 29 years ago, I married a farm boy and have been an ag worker ever since. Before that, I was in the military. 5 days before that, I had just graduated from high school after growing up in an inner city of Massachusetts. Ag businesses are hard enough to operate and manage, and this legislative session has strived to make it harder. I respectfully oppose Senate Bill 260 and oppose these regulations being in the hands of activists and activist politicians who have no expertise in the area and clearly no understanding of the industries that they are attempting to mandate. With the various emergency industries exempt from the regulations in this bill, why is the agricultural sector left out of the exemption? What will happen to livestock during a wildfire? Are the ranchers and ranch hands not allowed to save them? Must they burn in the fire while everyone sits inside? If homes are valuable enough to exempt, for the sake of, excuse me a second here. If homes are valuable enough to exempt firefighters from this bill, why are those on a ranch not exempt for the sake of saving their animals? Ranches in Nevada are very remote, and firefighters are not going to get there soon. And when they do, they aren't going to mount a horse and move livestock to a safe location. During wildfires, ranchers are the first responders. They will use their own water trucks and whatever they have on hand to start combating the fire, often putting it out before it gets out of control. I believe ag, although vital, is not exempt due to the sponsors' ignorance of the effects this bill would have, and or the sponsors are purposely targeting employers in the ag industry. Either way, when drafting of such regulations are put in the hands of unqualified personnel, credibility is questioned as to, are we really looking out for the worker, or is this about job security of activists and politicians?
Ma'am, can you please wrap up your testimony? Your time has ended.
I'm done, thank you.
Thank you for your testimony. Broadcast, is there anyone else on the line?
Chair, we have no additional callers to provide opposition testimony.
Thank you. We will start with neutral testimony here in Carson City. Is there anyone wishing to testify in neutral? You may begin when you're ready.
Good afternoon, Madam Chair, members of the committee. Paul Moran with the Vegas Chamber. The Chamber would have first like to thank Senator Flores and Jackie Spicer for the efforts on this bill. So the Chamber is neutral, and I do want to point out we do believe the regulatory process works. That's why we believe that this bill is in a good spot. We saw the success of the heat mitigation process was very robust. It took over a year, but there were a massive amount of engagement from the business community, labor activists, advocates and so forth. And we believe that that model will help us move forward on this particular bill, especially as we work more on the air quality control side. We felt regulation and process will give OSHA the better tools and flexibility they'll need as this area develops for Nevada. So again, I want to thank Senator Flores and those advocates for working with us. It was yeoman's work. I mean, many hours and meetings to get there, but we do appreciate working with us, and we're happy to say we've come to a resolution today. Thank you, Madam Chair, members of the committee.
Good afternoon, Madam Chair, members of the committee. For the record, I'm Paul Enos. I'm the CEO of the Nevada Trucking Association. Initially, we were opposed to this bill. However, we worked with the sponsor and the proponents and would like to thank them to coming up with some law that will actually put this in regulation, where we do feel that is the most appropriate place to deal with these kind of things. You have a tremendously more input from the stakeholders, from the various industries that are going to be involved. So we are neutral today, and once again, thank the sponsor proponents for working with us. Thank you.
Thank you. Good afternoon, Madam Chair, members of the committee. For the record, Andrew McKay, Executive Director of the Nevada Franchise Auto Dealers Association. For those of you that were on this STEAM committee last session, this is kind of seems like Groundhog Day. I think we're down to the 11th hour working on heat regulations. This is very similar in that we began in that process, just like this one, diametrically opposed to the bill proponents. But thanks to Senator Flores, Ms. Spicer, Ms. Tanager, we've been able to come to a common place and put it to where it appropriately should be. As Senator Flores accurately stated, there are disparate industries all over this state, and by going the regulatory route, we're going to be able to frame those up instead of just having a wide breadth approach. So wanted to put it on the record and thank the bill sponsor as well as Ms. Spicer, Ms. Tanager for meeting countless times with the business industry and the stakeholders and coming to a resolution on this. Thanks, Madam Chair.
Good morning, Madam Chair, members of the committee. Carrie Kramer here on behalf of NAOP. We too are in neutral after we've had so many stakeholder meetings with the sponsor and the advocates of this bill, and we just really want to say thank you to them for working so hard with us, and we're looking forward to the regulatory process. Thank you.
Thank you, Chair and members of the committee. Joe Hill with the Retail Association of Nevada. We are neutral as amended. We would like to thank Ms. Spicer and Senator Flores for their work on this bill. Thank you.
Thank you, Madam Chair, members of the committee. Alexis Motorex with the Nevada Chapter Associated General Contractors. I too would like to express my sincere thanks to the sponsor and proponents of this bill for hearing the concerns of the business community and working hard to get to a place where we're neutral and continue to work together on this issue through the regulatory process. But I would like to follow up on Assemblymember Anderson's question. Our members get called out during natural disasters, so in this particular circumstance, it would apply to fire, to remove debris, to be able to use their equipment to move debris. Sometimes they're water trucks, sometimes to help dig the fire lines. They're not technically emergency service providers. And so as long as the legislative intent is clear, we don't need to try and muck this up by amending in, sheriff's auxiliary members. Unless that isn't adequate, then we would need that amended in to make sure that our members could go out, even if it's not a declared natural disaster or emergency, to be able to provide that assistance. In the fires, the Davis fire was a great example. It wasn't a declared emergency, but our guys were out there assisting. And so as long as they are protected from the work stoppage, if that air quality level is such that it would require that at the scene, then we are happy to be neutral in this. Otherwise, might need a ever so small tweak. Thank you.
Thank you, Madam Chair, members of the committee. For the record, Terry Graves. Speaking for the Nevada Manufacturers Association, we started out in opposition to the bill, and we are now neutral, and thank Senator Flores and Jackie Spicer for accommodating most of our concerns on this bill. So we are in neutral. Thank you.
Good afternoon, Brian Reeder. Speaking on behalf of the Nevada Contractors Association, just want to say we're neutral and thank the bill sponsor and the proponents for their hard work.
Zoe Houghton here on behalf of the National Electrical Contractors Association, echo the earlier comments and thank the sponsors for working with us. Thank you.
Is there anyone else in Carson City wishing to testify in neutral? I don't see anyone. There's no one in Las Vegas. Broadcast, is there anyone on the line?
Thank you, Chair. At this time, we have no callers to provide neutral testimony.
Thank you. Senator, would you like to give any final remarks? I will now close the hearing on Senate Bill 260. Pursuant to Rule 57.4, Speaker has waived the 24-hour rule, and so we will work session Senate Bill 260. Is there any questions on Senate Bill 260, committee members? I don't see any. I'll entertain a motion on Senate Bill 260. So moved. Second. To do pass? So moved to do pass. I have a first from Assemblymember Miller, a second from Assemblymember Torres Fawcett. Any discussion on the motion? I don't see any. All those in favor say aye. Aye. All those opposed say nay. Motion carries. I'll assign that floor statement to Assemblymember Torres Fawcett. That is our last bill on our work session today. I will now open up for public comment. Please address your remarks to issues that fall within the jurisdiction of this committee. Public comment is limited to 2 minutes per person. Is there anyone in Carson City that wishes to give public comment? I don't see anyone. I don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
If you would like to provide public comment, please press *9 to take your place in the queue. Chair, we have no callers wishing to give public comment at this time.
Thank you so much. That will conclude our meeting for today. This meeting's adjourned.